What if that tiny itch you've been ignoring isn't just dry skin, but your body's way of warning you? We're not talking about the usual itches caused by soap, detergent, or the weather. We mean specific, persistent itching in unusual places with no visible cause. Especially for adults over 60, this could be a critical early signal of certain types of cancer. This is not to create fear. This is to create awareness. Because early detection can mean the difference between life and loss. Welcome to Elderly Active Life, your go-to source for health wisdom, lifestyle tips, and preventive care, all tailored for seniors. In today's video, we're diving deep into why chronic itching could be a warning sign, the 5 most suspicious itch zones, real-life examples from seniors who notice these signs, and practical steps to take if something doesn't feel right. Before we dive in, take a moment to like, subscribe, and turn on notifications. You never know when the next video could help save a life, maybe even yours. Understanding the link between cancer and itching. Many cancers don't start with pain. They start with a whisper, and sometimes that whisper comes in the form of a persistent, unexplained itch. Here's why. Some cancers, especially lymphoma and leukemia, release cytokines, chemicals that irritate nerve endings. Others, like pancreatic or liver cancers, may block bile ducts, causing bile salts to accumulate in the blood and trigger itching. Skin cancers, especially in their earliest stages, can begin with a simple itching spot before any bump or mole appears. Inflammatory breast cancer doesn't always form a lump. It can start with a thickening of skin or a persistent itch around the breast area. So if you're dealing with an itch that just won't quit and can't be traced back to anything external, it might be time to take a closer look. Sign number 1, persistent itching on the lower legs. What to look for? Constant itching on the shins or calves. Skin looks normal. No rash, no flaking. Worsens in the evening or at night. Why it matters? This is one of the most frequently overlooked symptoms of Hodgkin's lymphoma and other blood cancers. These cancers affect your lymphatic system and immune response, which can trigger itchy nerve signals without causing any skin damage. Real story. George, 75, began scratching his lower legs every night. His doctor initially diagnosed dry skin. 6 months later, routine blood work revealed abnormal lymphocyte counts, and a biopsy confirmed lymphoma. Blood cancers often trigger night sweats, fatigue, and unexplained weight loss. The itching can start months before any of those symptoms appear. This itch often doesn't respond to moisturizers. Action step: ask for a CBC, complete blood count test, and lymph node examination if you've had this type of itch for more than 4 weeks. Comment 1 below if you've ever had an unexplained itch on your legs. You're not alone. Sign number 2, itching between the shoulder blades. What to look for? Deep itch under the skin between the shoulder blades. You can't reach it, and no amount of scratching helps. No rash, bumps, or clear cause. Why it matters? This is a surprising early sign of pancreatic cancer. As the tumor presses against nearby ducts, it can block bile flow, causing bile salts to leak into the bloodstream. These salts cause systemic itching, often felt in the upper back. Real story. Linda, 70, described her sensation as a ghost itch. Her doctor initially thought it was a pinched nerve, but when her urine turned dark and she began feeling tired, tests revealed elevated liver enzymes and a small pancreatic tumor. Pancreatic cancer is called the silent killer because symptoms often appear late, but itching may come earlier than expected. May also be accompanied by digestive discomfort, loss of appetite, or pale-colored stools. Action step: ask for liver function tests and abdominal imaging if this itch is persistent. Comment 2 if you've experienced an itchy upper back without a cause. Awareness saves lives. Sign number 3, itchy scalp without dandruff. What to look for? Crawling or tingling sensation on the scalp. No dandruff, no visible irritation. Feels like something is there, but nothing is. Why it matters? This can be linked to leukemia, non-Hodgkin lymphoma, or even early scalp skin cancer. Real story. Henry, 73, thought his hat was irritating him. After changing products, shampoos, and routines, the itch stayed. Routine blood tests later flagged high white blood cell counts. He was diagnosed with chronic lymphocytic leukemia. Leukemia can also make your skin more sensitive to temperature and fabrics. Skin cancers on the scalp may begin with only mild symptoms, and seniors with thinning hair are especially vulnerable. Action step: ask your doctor for dermatology and hematology screenings if your scalp itches without clear cause. Comment 3 if your scalp has been itching more than usual. Let's talk about it. Sign number 4. Localized itching on the chest or breast. What to look for: itching around the nipple or under the breast. No rash, irritation, or allergy explanation. Often comes with skin thickening or subtle dimpling. Why it matters: this is often seen in cases of inflammatory breast cancer, an aggressive cancer that doesn't always form a lump. Real story: Ruth, 69, noticed a subtle itch beneath her left breast. At first, she blamed her bra. Over time, she noticed slight puckering of the skin. A scan revealed a tumor pressing close to the skin. This sign applies to men as well as women. Inflammatory breast cancer progresses rapidly. Early detection is vital. Action step: request a mammogram or ultrasound if this itch is persistent and localized. Comment 4 if you've ever experienced an unusual chest itch. It's time we talk more openly. Sign number 5. Persistent itching in the genital or anal area. What to look for: chronic itching in one spot. Doesn't improve with better hygiene or over-the-counter creams. May feel raw, burning, or slightly swollen. Why it matters: it could indicate anal, vulvar, or penile cancers, especially in seniors. These cancers are often misdiagnosed as hemorrhoids or infections. Real story: Eugene, 76, had itching he thought was from hemorrhoids. After nearly a year and no relief, a colorectal exam found a small tumor in his anal canal. These cancers often develop slowly and quietly. The risk increases with age and HPV exposure. Action step: don't hesitate to see a dermatologist or colorectal specialist if you've had itching in the same spot for more than a few weeks. Comment 5 if this section resonated with you or someone you know. General health tips for seniors. Track symptoms in a notebook. Date, severity, triggers. Keep your skin hydrated. Dry skin can worsen neurological itch. Perform monthly skin self-exams, especially in hard-to-see areas. Eat an anti-inflammatory diet to reduce internal triggers. Schedule annual wellness checks that include a skin and lymphatic system review. How to talk to your doctor about unusual itching. Start with: this itch has lasted longer than usual and doesn't respond to treatment. Could it be linked to something systemic or internal? Should we run any blood work or imaging just to be sure? Bring photos, a timeline, and related symptoms. Being prepared helps your doctor take your concerns seriously. The science behind itching and cancer. Persistent itching, especially without a clear cause, can be your immune system's early alert. Here's why. Cytokine storms. Some cancers cause the body to release inflammatory proteins, cytokines, that activate skin nerves, causing itching without any external trigger. Histamine-like effects. Blood cancers such as Hodgkin's and non-Hodgkin's lymphoma can make immune cells release histamine-like substances, mimicking allergic reactions even without allergens. Liver and bile duct problems. Tumors in the liver or pancreas can block bile flow, causing bile salts to build up in the blood. These salts irritate skin nerves, leading to itching, often on the back, arms, and legs. Skin cell changes. Some cancers, like squamous cell carcinoma or Paget's disease of the breast, start with microscopic skin cell changes before any visible lesion appears. A persistent itch may be the only early sign. Key point: the itch often comes from issues beneath the skin, not the skin itself. Why seniors should pay closer attention. As we age, our skin thins, loses elasticity, and becomes more sensitive. So we might mistake serious symptoms for normal aging. Why seniors need to be extra careful. Weakened immune system. Older adults may show subtle cancer signs. Multiple medications. These can hide or mimic itching causes. Slower metabolism. Toxins and bile salts stay longer, causing more itching. Did you know? Cancer-related itching often worsens at night when inflammation peaks. If it wakes you up, that's a warning sign. When it's not cancer but still needs attention. While cancer is a serious cause, other health issues can also cause unexplained itching in seniors. Kidney disease. Toxin buildup irritates nerves and skin. Thyroid problems. Both underactive and overactive thyroid can affect skin and cause itching. Diabetes. Poor circulation and nerve damage lead to itching. Iron deficiency anemia. Low iron makes skin more sensitive. Remember, itching isn't always cancer, but persistent itch with other symptoms like fatigue or swelling deserves a doctor's attention. Final thoughts. Listen before it screams. Your body rarely shouts in the beginning, it whispers. That whisper may be a tickle on your leg, a strange itch on your back, or an unshakable discomfort near your chest. Don't ignore these signs. Early detection saves lives, and when it comes to cancer, being 2 months early can be everything. Thank you for watching Elderly Active Life. Like, subscribe, and share this video with your loved ones over 60. You never know who needs this information. In the comments, what's something you've learned today that you'll remember forever? Stay safe, stay informed. We'll see you in tomorrow's video.